Hello, welcome back. The topic today is how diet and nutrition is very important in piles. So, piles is nothing but in the anal rectal region, the blood vessels are enlarged and they're bleeding. The painless bleeding is called hemorrhoids or piles. How diet and nutrition helps in their treatment. So, we all know the main reason for piles is constipation and sedentary lifestyle. So the constipation is mainly most of the time because of lack of fibers. So fibers are very important, and the fibers we can everybody knows the best and easily available is fruits and vegetables. All colorful fruits and vegetables has a lot of fibers. The same way the grains or the legumes, they all have fibers. So the fibers are two types. One is soluble and insoluble. The soluble fibers, they dissolve and they form a jelly-like thing between the colon and the motion, and helps to form a free motion. The soluble fibers, they dissolve in the motion. They increase the bulk of the motion and consistency of the motion and help to pass free motion. And the best classical example you can say is wheat. When we have whole wheat as a food, the fiber is rich. But when we polish it and make it as maida or the wheat flour, then the fibers are gone and they can lead to constipation. So this is number one. Number two is water. So water is very essential to keep the consistency of the motion, so that the free passage of the motion is maintained. If there is a dehydration or less water, the motion becomes dry. When a dry motion rubs the piles, they get bleeding. So most of the time, 95% of the piles falls under the category of grade 1 and 2. They don't need any intervention. Mostly diet, exercise, lifestyle changes is more than enough. Only a grade 3 and 4 or bleeding piles, they need surgery. Even for people who go undergoing surgery, these fibers and water intake and lifestyle changes very important. So piles, the diet, nutrition is very important for the conservative treatment or even after the surgery. Thank you.